Welcome back to the Comcast Spotlight. I'm Dana Geisler, and I'm here with Wakeshi Benson, who is an orthodontist at WB Orthodontics. How are you doing this today?
I'm doing great. How about yourself, Dana?
Great. Thank you so much for being here. So, what is WB Orthodontics?
Before I go into WB Orthodontics, I would like to explain a little bit about the definition of orthodontics.
Yes.
It's dealing with the straightening of teeth as well as jaw relationship. So when you hear people say they have an underbite or overbite, that's the jaw relationship that they're describing in their own terms. And we also deal with the control and modification of facial growth. So it's pretty complex, but pretty much dealing with creating a healthy smile, straight smile, that is.
And your office is just about to open here.
Correct.
So tell us about your practice, what makes it special, and this experience of opening your own shop.
Well, I think what makes WB Orthodontics special is because, first of all, the WB in orthodontics is my initials, so it's very personalized to me. So when I see it on the door, it's definitely something that hits home, and it's very something that's dear to my heart. With the type of care that we provide at WB Orthodontics, we create a warm, friendly environment from your first encounter with the front desk to the lobby, which is also catering towards kids, teenagers, a teenage section where they could play video games, and the parents where they could just sit down and relax, because sometimes your first appointment may be about an hour or so. And then we go back in the consultation room where you have a free consultation, and we listen to your chief complaint. We customize your treatment plan, explain everything in details. We are bilingual, so we are available for Spanish-speaking individuals, so that's a plus for us. And when you go to the back, pretty much we're focusing on the patient. Sometimes you go into a practice and it's very large and you just feel like a number. No, you're going to feel like a person in a chair that has important information to share, and we have important information to give.
So are you all a family practice, or do you focus on children and teenagers? What is your primary focus with patients?
I like from age 7 to 70, and I especially love seniors, because sometimes when they get their teeth straightened, they're able to brush and floss a little bit better because their dexterity may decrease with age. So straighter teeth allows them to get to those areas a little bit better. So I enjoy working with the small children as well as adults and seniors.
Has there been, it's been a while since I had my braces, has there been innovation in this area recently, or maybe people who probably haven't had braces in a long time and don't realize that there's new ways for correcting your teeth?
Yes, I think back in the day, pretty much it was a little bit painful, I think, because of the size of the bracket and the way that they place the brackets on the teeth. Right now, they're small, they're sleek. You can get traditional metal braces. That's what I had when I was in 7th grade. Ceramic braces, which is tooth-colored braces, so they're more aesthetic now. And you can get what they call invisible braces, which is Invisalign, which you might not even know the person's wearing that type of clear plastic appliance. And some of the things that's new in orthodontics is customized treatment that's digitalized.
Oh, wow.
Yes, so they can place your model or your mold can be transferred to the computer, and brackets can be customized for tooth movement, as well as the wire can be bent robotically as well for tooth movement. And the results that you see on the computer are the same results that can be replicated in the mouth. So we're going to the computer age with orthodontics, and that's allowing treatment to be faster, less appointments, and just saving you overall from taking off from work. And the other thing that's the future for orthodontics is we're doing more temporary anchorage device, which is called TADs. So if a person is missing a tooth, such as maybe an older individual, we can place that anchorage device to be able to pull from, because there's no tooth to anchor things back. So we're able to go into dentistry with, if there's no tooth, we're able to create something that can still allow movement, and also we can do laser treatment. So sometimes people have a gummy smile and they have tooth structure underneath those gum tissues, and sometimes we can laser them back in order to see more tooth structure when they smile. And if there's any area of problem, we can also laser that. So sometimes with brackets, it may rub and you might get an ulcer. You can also laser that ulcer area, and it provides faster healing and less and comfort for the patient, less pain.
Well, so tell me, I am the area of medicine I am not well versed in, and it's just I'm amazed at the ability of doctors and orthodontists. And how did you grow up knowing that this is the area that you wanted to go into and study? How did you get to where you are now?
When I was in 7th grade, I was referred to the orthodontist, and it was deemed that treatment was necessary. I had every dental malocclusion or malalignment that you can think of. But I'm grateful to have an orthodontist named Edward Sylvester. He's not living today, but he was very influential in my life. He asked the question, what would you like to be when you grow up? And I just looked at him and I thought, So he was your mentor? He was my mentor. He was the one who first asked me the question, who got me thinking about the career path of orthodontics. And he pretty much made me go around the office and stick with his assistants, and he showed me everything about orthodontics that he could at each appointment. So I was thankful for my beautiful, healthy smile, and I think today that's one of my big assets that I hear that I have is my smile. So I'm grateful for him because it's a life-changing event, and it's also improved my self-esteem, and that's what I like to do for others. Not only improve their smile, but their self-esteem, their self-image, and give them a lifelong, lasting smile that nobody can take away.
And that mentor piece is so important. We just earlier were meeting with our CHAMPS committee and briefly touched on mentorship and some of the things that they were talking about, and showing, inspiring a youth into a career path is so important. So I'm glad to hear a success story from you around that. So when did you decide to open your practice? How long has this been a journey for you, actually, coming to opening your doors?
Okay, well, I went to the University of Michigan Dental School, and I graduated in 2000. I practiced dentistry at the VA hospital to get advanced dental treatment and work with compromised patients. So I was very comfortable in the dental field after that experience. And then I went on and practiced in the Detroit metropolitan area for 5 years after that 1 year residency at the VA hospital. And I applied for orthodontic program, got into Howard University. It was a 2-year specialty program which I received a certificate, and that's when I moved down to the Richmond area and practiced as an associate for 5 years in orthodontics. And I decided that after 5 years, it was my time to open up, shop and provide those services that I would once receive to others.
So tell us where your shop is located, or where it will be opening doors soon, where you are.
Oh yes, we're excited to open our doors. We're located in the heart of Chester, and it's 12230 Iron Bridge Road, and Chester, Virginia 23831. We're located right at the corner of Iron Bridge and Chalkley, and that's a major intersection for Chester because it's where the Walmart, American Fam Fitness, and Patient First is located.
Yeah.
So, and Iron Bridge is so easily accessible for Richmonders as well as people in the Chester area. You can get to it from 288, Chippenham Parkway, or 95.
So if you had advice for a young student who's interested in orthodontics, what would you tell them?
I would tell them that orthodontics is a great field. It's especially good for women because you can open your doors to, 5 days a week or 3 days a week and customize your schedule. It allows autonomy, and it's a field where you can just improve someone's smile, self-image, and if you love math and science, you can use those skills to create that beautiful smile for others. So I think that it's a good field, and I would like for as many people to check us out on Facebook or go to our website, wb-orthodontics.com, and just look us up and see what we're about. I think we're about personalized care. I think we're about customized care, and I think we're a warm, friendly environment that's for all ages.
Well, thank you so much for being here. We're very excited for you.
Thank you so much for having me. I appreciate it.